Hi guys, welcome back to Yanika's Lupus Life. I hope you're having an awesome and blessed day today. In today's video, I'll be going over what lupus is, the warning signs and symptoms of lupus, and lupus diagnosis. Lupus is a complex chronic autoimmune disease which causes your immune system to mistakenly attack your healthy tissues and cells, and it can damage many parts of the body and can lead to chronic inflammation. Lupus is still a mystery. There is no known cause for this disease, but there is evidence showing that genetics, hormones, and environmental factors such as infections and viruses also play a role. 9 out of 10 people living with lupus are women. It's also common in women between the ages of 15 and 44, which is childbearing age. Now let's talk about lupus symptoms, and I'm going to discuss the most common symptoms first, then we will go to the less common symptoms. So fatigue, that's the most common symptom of lupus, and about 80% of people experience fatigue as their main symptom. Skin rash, this is one of the most visible symptoms of lupus. It can occur suddenly or after exposure to sunlight. Unexplained fever. This is a fever you get for no reason, and it's a low-grade fever. You don't think anything much of it, so you don't see the need to consult your doctor. But a low-grade fever can be a symptom of infection, inflammation, or a flare-up, and it's also more common during flare-ups. Another symptom is photosensitivity. Many people living with lupus are sensitive to sunlight and UV ray light, especially people that are living with skin lupus. Being exposed to light can cause joint pain, skin rash, among other symptoms. Hair loss. Living with lupus can cause your hair to thin out. Some people lose it in big clumps, while some lose it at a slower pace. And that's also another early sign or symptom of lupus. Another symptom is chest pain. You can get inflammation in your chest, which causes chest pain, difficulty breathing, and shortness of breath. Mouth and nose sores or ulcers. So this is another common symptom of lupus, and it can be persistent and very painful. Another common symptom is joint pain, and when this happens, it can be mistaken for arthritis. I know we mostly talk about the common symptoms of lupus, but there are also other symptoms that may be linked to the disease. They don't always occur in all people living with lupus, but it's very important for us to discuss them. The first one I'll be talking about is kidney problems. This is known as lupus nephritis. This is where you get inflammation in your kidneys, which can cause kidney damage or impaired kidney function. Pleurisy. This is inflammation of the lining of the lungs. It can cause difficulty breathing and chest pain. Neurological symptoms. Your nervous system can be affected by lupus, which can cause dizziness, seizures, headaches, and cognitive dysfunction. And the other one is gastrointestinal symptoms. Sometimes lupus can cause digestive issues such as acid reflux, heartburn, abdominal pain, and nausea. Keep in mind that not everyone living with lupus will experience all of these symptoms. Some may experience the common symptoms, while some experience the less common symptoms, or both. If you or someone you know are experiencing any of these symptoms and you are thinking or wondering if it's linked to lupus, then it's important for you to consult your doctor so they can give you a proper diagnosis and rule out other ailments. Now, let's get into lupus diagnosis. Lupus can take a long time to diagnose, and the average time from the onset of symptoms is 6 years. The reason for this is the many challenges with the disease. Symptoms come and go. They can be unclear as well as mimic other diseases as well. There are criteria for lupus diagnosis, and based on American College of Rheumatology, there are 11. And you need 4 or more of these symptoms to consider a lupus diagnosis. But we all know that not everyone is the same. We are all bio-individual. So some may have 4 or more of these symptoms, and some may have less than 4 of these symptoms, while others may have all 11 criteria. Other tests that can be done are blood tests, imaging, or biopsy. They're also done to either give you a proper diagnosis or rule out other ailments or conditions.